As members of the human species, every individual is unique, no matter their ethnic or cultural background, their belief system, socioeconomic status, or geographic location. Every human being has needs, specifically healthcare needs. Healthcare has to be unique to every person to adequately meet their needs. These differences should not dictate quality. However, research shows that in our society it does. Regarding geography, where an underprivileged person calls home is a key factor that can determine their quality of health and their life expectancy. This presentation seeks to discuss some of the factors that affect life expectancy for the poor and offer examples of cities that are making progress to close the gap between the rich and the poor. In our country, inequalities exist in healthcare based on a person's gender, race, economic status, and geography. Harvard published an article recently that focused on trying to understand the inequalities that exist in healthcare. They found, and I quote, "If you're having a heart attack, there are very standard protocols. If you're African American, you're less likely to get those, even with the same health insurance, even with the same presentation. Substandard care leads to 260 premature African American deaths daily." Unquote. Sadly, discrimination is prevalent in healthcare and is a contributing factor of shorter life expectancy rates among the poor. These disparities experienced by minorities and the underprivileged lead to poor health and health outcomes and results in a shorter life expectancy compared with wealthy Americans. Healthcare reform is taking place in the United States, but trying to fix a complex and multi-layered problem takes time, which, for the poorest Americans, is something they are running out of. In 2010, Congress passed the Affordable Care Act in an attempt to close the gap of those without insurance. While this was a step in the right direction, it has still left millions of Americans without insurance. And even with more Americans being able to purchase health insurance, it has not eliminated the disparities that plague the healthcare system. Minorities and the underprivileged still struggle to receive quality levels of care. The Health Inequality Project, and I'm quoting from their website, uses big data to measure differences in life expectancy by income across areas and identify strategies to improve health outcomes for low-income Americans. Unquote. They are an organization that is seeking to reduce health disparities through the gathering of data that can be utilized in formulating strategies to improve health care for everyone. This graph, taken from their website, shows the life expectancy rates for men, represented by the blue line, and women, represented by the red line, at age 40. Both are adjusted for race. As you can see, as the income level increases in both genders, so does the life expectancy rate. The wealthiest American men live 15 years longer than the poorest men. For women, the difference is 10 years. This data demonstrates how vast the gap has become between the rich and the poor. The New York Times recently published an article based on the findings of the Health Inequality Project, which found that in certain parts of the country, the poorest adults' life expectancy is equal to that of much poorer countries, such as Rwanda, and lifespans in the U.S. are getting shorter. Life expectancy rates for the poor has a strong relationship to their geographical location. For the richest Americans, geography does not affect their quality or quantity of life. From 2001 to 2014, the wealthiest Americans gained approximately 3 years longevity, while the poor experienced no gains. If we take a look at this image from the Health Inequality Project, it shows a map of the United States. It provides a visual for the life expectancy for the poorest individuals by state. Notice the stretch in the middle of the country that includes the states Michigan, Ohio, Indiana, Kentucky, Tennessee, Arkansas, Oklahoma, and Kansas, where life expectancy is the lowest. This stretch correlates to what Harvard economist David M. Cutler calls the drug overdose belt, where there is an increased rate of opioid addiction and overdoses. In the New York Times article mentioned earlier, the authors discuss the rise in death rates among middle-aged white Americans from, quote, drug and alcohol poisoning, suicides, and accidents, unquote. Due to the increase in mortality rates among this population, the projections for life expectancy among the poor will be even less than researchers are estimating. This graph and the information it reveals demonstrates how complex and multifaceted this problem is, and it shows why this topic is so important. Let's look at this issue a little more specifically. This graph, taken from the Health Inequality Project's website, shows life expectancy rates at age 40, adjusted for race, by location, and income. On the left side of the graph, there are 4 different cities: New York City, San Francisco, Dallas, and Detroit. The lowest income population's lifespan varies approximately 6 years from New York City to Detroit. As incomes rise, however, the gap begins to close. If you are wealthy, where you live in regards to your health does not matter. If you're poor, however, your location plays a huge role in your quality of health and life expectancy. The poor live around 6 years longer in New York City than they do in Detroit. What explains the differences in life expectancy rates between these areas? The Health Inequality Project states, and I quote, "Much of the variation in life expectancy across areas is explained by differences in health behaviors, such as smoking and exercise. Differences in life expectancy among the poor are not strongly associated with differences in access to health care or levels of income inequality. Instead, the poor live longest in affluent cities with highly educated populations and high levels of local government expenditures, such as New York and San Francisco." Unquote. This research is vital in moving forward towards health equality. Education regarding healthy lifestyle choices is a key factor in improving health and life expectancy rates among the poor. This graph from the Health Inequality Project shows life expectancy at age 40, adjusted for race, from the years 2001 and 2014 in 2 cities side by side, Birmingham, Alabama on the left and Tampa, Florida on the right. Women are represented by the red line, men by the blue line. In Birmingham, life expectancy rates increased for both men and women during this time frame, whereas in Tampa, life expectancy rates decreased for both men and women during this time frame. These findings show us that life expectancy rates are not fixed. There are measures that can be taken to improve health. Looking at Birmingham, Alabama, which is located in Jefferson County, what are they doing to improve quality of life among the poor? The New York Times interviewed Dr. Mark E. Wilson, who is the chief executive of the health department in Jefferson County, to find out more information about their strategy. Dr. Wilson discussed multiple ways in which they have improved the health of their community. First, they have expanded the availability of preventative health care, opening clinics in lower income areas. Jefferson County also budgets out a portion of local taxes to cover health care costs incurred by those not covered by health insurance. Also, they have passed laws to ban smoking in restaurants and workplaces. Finally, several foundations backed by old industrial money from the area have funded campaigns with the mission to help people get healthier. These measures all focus on creating a community that values health. Health and healthcare affects all of us. It is a global issue and a personal issue. The research provided by the Health Inequality Project and the examples of cities like Birmingham, Alabama, shows that when greater emphasis is put on education regarding healthy lifestyle choices at a community level, that is when change can effectively take place. Making education regarding health easily accessible through community-sponsored health awareness events and mobile clinics that takes health care to the individual are a few strategies that, executed at the local level, can have huge positive impacts on the quality and quantity of life of those with the greatest risks.